A warm round of applause for Dr. Sameer Mehta. Representing the proponents, I am pleased to invite Ms. Josephine Cyril, Chief Nursing Officer, Sir Gangaram Hospital, New Delhi; Ms. Pooja Nair, Professor and Head, Medical Surgical Nursing, PD Hinduja College of Nursing; Ms. Elaine Augustine, third year Basic BSc Nursing student, Yashoda College of Nursing, Telangana. May I request our chairperson and proponents to kindly take their seats on the dais.
And of course, to spice things up, we also need opponents. And calling upon the opponents, Ms. Joy Kezia, CNO, Apollo Hospital, member ANI; Dr. Srilekha Rajesh, Dean, Nursing Faculty, MUHS, and Vice Principal, GMF, TGINE, member ANI; and Suveta Mudliar, fourth year BSc Nursing student from Sir HN and RC College of Nursing, Mumbai.
Please give them all a big round of applause.
Dr. Sameer, sir, all yours.
Thanks. I can see a lot of people in the audience waiting for some spice, but I don't see the anticipation of what you're looking forward to. Come on, guys, this is the last session of the day. We changed it so that we could be flexible to our fellows. Come on, clap for the 6 wonderful ladies on the side. This is like half-hearted. Are you really going to see? Guys, you have to see this. Action or illusion? Who thinks it's action? It looks like nobody. All gone to sleep. How many think it's okay, 1. Illusion. Binu, you're supposed to be head of a nursing association, man. Hey, you have to start from within. Who thinks illusion? Come on. I'm going to come down there. Okay, good. We've got like 5 people. Clearly, you're all asleep. Guys, this is one of the tough topics, right? Because you're caught between the devil and a hard space. Is it, God, nurse, save me, right? Or is it, hey, salary time, who gets screwed in this next salary process? Is it, we're going to invest in our nurses, we're going to give them rewards? Or is it going to be, this technology costs too much, let us get a new CT machine, let's forget about the nice model to make nursing life easier? See, this is the reality that's faced. As a decision maker, most of you will get faced, and as I have heard repeatedly, when you're on a decision-making table, the view from the top is very different from the view when you're climbing through it. I will tell you, the trade-offs that you have to make are not simple. I hope that this panel gives you some ideas to challenge this, whether you believe it or whether you don't. But first, let's understand what the real position is. So I've got 3 outstanding panelists we're going to go sequentially. Whether they're going to talk about opportunities, competencies, promotions and rewards, or the 3 ladies on the challenging side are going to talk about, actually, we're not even invited on the table when it matters. Or are they going to talk about something more profound, which is, you know, where are the rewards after all this hard career? Clara, you promised me the world. Tangamji, you said wonders abound. Ajita, I can see you, but you're like the only one there, right? You and our other favorite madam who's sitting in Kim's, right? And I think what this session wants to do is leave seeds in your head on how to do it. And then we will end with the students. Hopefully you will tell us what you're seeing and you will challenge some of the myths from earlier today, because you're the next generation, and if you don't see opportunity here, you won't do what matters. So I think with that, let us start with the simplest of things. I will turn to my right, this way, and Josephine, you're up. Are we going to hear about support, opportunity, seat on the table, whether you have good well-being? Come on, it's all yours.
Good evening, everyone. So, 5 years back or few years back, if I had to speak about this topic, I would have put illusion on the table. But today, I will talk in favor of the topic, that is, it's a reality. So if you look at, I have listed few points so that you all can agree with me or not. The most important thing is in nursing, legal, the legal aspects, legal and policy support. If you look at nurse-patient ratio, once upon a time, there was only said, there was nothing written. Now today we have NABH 6th edition, Nursing Excellence 2nd edition, we have Indian Nursing Council and other guidelines talking about nurse-patient ratio. So most importantly, the number of nurses, the staffing in a workplace, in the hospital or in a small nursing home is no more said, no more celebrated. It is words written on paper. It's a reality today. It has to be there. It's a law. And it is an element in the standard which is assessed during an assessment. So legal part is very, very important. And when it comes to Clinical Establishment Act and also State Nursing Council, they also talk about adequate staffing. Indian Nursing Council, they talk about adequate staffing. And if you look at other policy, like a prescription, today in the morning also you were talking about, you were hearing about nurse practitioners. India is coming up with the various nurse practitioners, and nurse practitioners today, they can prescribe, they can earn a better income, they are even almost equivalent to the doctors, and it has started, the process has started. So again, in the policy making, in the table, we are there. In Tamil Nadu and in Kerala, you might have read in various newspapers and in the media, we generally talk about salary and other things. The minimum basic salary is made to 40,000. And it has started. You may challenge, you may say that now even in many hospitals, this has not been initiated. Even the place where I work, nurses are paid well. So the process has started already. Now when it comes to clinical strength, when I talk the reality, today we are no more into words and we are just, in one of the presentations in the morning I saw, we are proactive. We are not just reactive. I can talk about how we practice in decision making. Let's talk about the symbol bundles. Club-C, Koti, I saw some of you have shown it here. Even whether a catheter to be inserted or whether a catheter, whether it is a urinary catheter or a central line to be there, is there a necessity to remove it? We can equally discuss along with the clinician and participate in the decision making. So we are no more just putting words, we are in the decision making. I'll give you an example. Just few days back, we had a high profile politician as a patient. My nurses failed to get the vein and they had tough time, and he was very particular about cannulation. The nurse walked into the vascular department, got a vascular doctor, brought him and put a good PICC line, and the patient was extremely happy. So we could take that call because we are empowered and we are no more standing behind. We are in the front taking decisions. Rapid response team. Today 70% of the rapid response team, we saw the early warning chart. We have a pediatric, neonatal, adult, obstetric early warning signs. Who initiates the early warning signs? The nurse. It's a reality. It's not an illusion. We initiate and the team respond and the patient life is saved. So variance in clinical pathways. Accredited hospitals, it is mandatory to have clinical pathways. JCI demands more, even NABH. Who checks, who are the clinical pathway champions today? We are the clinical pathway champions along with the clinicians, and we do the audit, we work as a team, and we track the variance and put it on table where we need to revise the pathway or change the pathway or stop the pathway and start a new beginning. We are no more standing and watching. It's a reality. Safety and well-being of the nurses. Today, every organization, CEO or COO or medical director or a nursing head is very concerned about the safety and well-being of the nurses. Day in and out, as CNOs, as nurse administrators, we are concerned about our team. It is not the size of the team, we are concerned. Even a simple example, needle stick injury, earlier we had to pay, today the organization pays for it. If you happen to have an NSI with a viral marker positive patient, the entire cost of post-exposure prophylaxis treatment is paid by the organization. Restrooms and other comfortable library, restrooms, creche, all these things today, many organizations make it happen for the staff well-being. In Maharashtra and in Karnataka, by 2022, a rule has been passed. Violence on nurses, it's a penalty. Even a bail is not given to the person who has committed the act. So it's a non-bailable one. So it is again nurses' safety. Now comes mental health concern. You know that, all of us know that 10 to 20% or 25% of our time in a day we spend on counseling our nurses. Something or other, something goes wrong. Workplace stress, personal problem, other society-related problem. So there are 24-hour support services in few of the corporate hospitals. And the psychologists, the psychiatrists, they are all ready to help them. So I'm not telling it's happening everywhere, but the process has been started. It's a reality now. It's no more an illusion. Now, there are many opportunities when it comes to education. I'm not talking about academic side. I'm talking about a clinical arena. Clinical arena, today nurses, we are no more only at the bedside. We are everywhere. You look at even a bed management system, nurses are the best. One of the doctor commented, nurses can be everywhere. Bed management system, along with the doctors, patient coordinators. One of the many roles already projected here on the slides. One thing I can say today, VTE nurses, venous thromboembolism, there is a committee and a lot of activities happening in hospitals. There are many deaths happening in the hospital due to pulmonary embolism. VTE nurses, stoma nurses, patient educators, lot many are there, yes. And the last, grievance and redressal. Grievance and redressal committee, it's no illusion. Anything happening to our nurses, we are there in the committee to talk for them. I tell you one good example, just recently, the budget. We just concluded in April the budget session. Who fought for the nurses? The management said you are too many in number, too many people extra in the system. The CNOs, it's no more illusion. Put the facts on the table, get the manpower approved and fight for your rights. You are no more sitting quietly and listening. That's what. Earlier we used to just stand and accept whatever happened. It is no more illusion, it's a reality. We have to speak and we are empowered to speak and get it approved. So there are many things we are doing. And the last, let me tell you friends, patient trust. You know, the public voting, even today as per WHO study, 84% of the public says nursing is the best profession so far where people can trust. We should be proud of it that we are there. And I'm not telling there are no gaps. There are no gaps. There are gaps. But is it all illusion? No. Is it all happening reality? Also no. But the process has started. I tell you friends, the support is there, the system is there, coordination is there. We are empowered. If you just still stand and watch, then we are leading to illusion. If you participate in action, we are strengthening the reality and the process has already started. Thank you.
Some hard things, huh? Voice on the table, direct opportunity to challenge manpower numbers. Voice on the table is a big one, guys. Don't underestimate. Public approval, you kind of like have got the public on your side. Even the AI systems agree, right? The nurse is the least likely profession in the whole of the human race to lose the job. First comes engineer, midway through comes doctor, nurse has still got a chance. But thank you, Josephine. I think that was strong. Come on, you can give a bit more applause. And now the person is going to take the air out of her. Joy, come on, all you, what are you going to say? Are you going to say, ye kya badmash hai? Idu yello poida.
When you keep talking lies many times, it invariably becomes the truth. 2020 was declared as Year of the Nurse. COVID came, made it truly Year of the Nurse. Made it truly Year of the COVID Nurse. And that was the only time nurses were uplifted, nurses were held, nurses were pampered. And then year on year, on that one particular happy birthday, Florence Nightingale Day, May 12th, Nurses Day, that's the day. Joy, you're the best. We'll never have another joy. Oh wow, I'm admired, I'm adored, I'm adopted into the system. June, now is the time this adoption, this adoration becomes everybody's accountability. AC is not working, call Joy. There's no water for my patient, call the nurse. Why is the patient staying so long after paying the bill on a discharge day? Call the nurse. Oh, why? Why am I asked to do things out of my licensing program? I'm not asked to practice scope, which is told by Nurses Practice Act. I'm asked to do everybody's practice, and that, my friends, is illusion. We are not there at reality yet. I'm asked to do everything else, and then I'm made to feel so good. Oh, Joy, without you, we can't exist. Of course, yes, you can't exist. That was point number one. They adopt me on May 12th, and they put me up for sale in June. Oh, she's the biggest fighter in the hospital. She fights for this, she fights for that, she fights, oh God, yes. Now I'm up for sale. Anybody wants me? I'm jobless. You can take me. That is illusion, my friends. Every day a CNO or a nursing head sitting here knows the pain of what I'm speaking. Every single day. He can transcribe wrong, he can prescribe wrong, but why didn't the nurse stop the administration? Oh, why should I? Why should I? He prescribed it wrong. He earns more than me. He practices more than me. His scope is wider than me. But why am I only being questioned? Come on, ladies and gentlemen, think. We are a lot of people in the boardrooms. My friend was very happy. I'm asking you today, that's an illusion. Get back to the bedside. Get back to the bedside, my friends. If you're spending a lot of time in the boardrooms, that is where nurses belong. Because we do not know what our little nurses are facing out there. We are happy inside aircon rooms. We are very happy getting food on our tables. We are happy looking at the dashboards, pink color, amber color, red color, green zone, white zone. Oh wow, rank cards. What did the poor nurse do? She's fighting for her life. She's fighting for a very meager hostel facility. That is an illusion. Have we given good places to stay for our nurses? No. I'm sorry we didn't. Yesterday I was watching a reel, and a man who's got recently married goes to the court to divorce his wife. And he says, "Sir, I'm divorcing her." The judge asks why. "This was the first day I saw her without makeup and I was scared." This is a nursing illusion, my friends. We are wearing masks for so many people around us. And when the pressure in the cooker is burning hot, how many of us can survive the heat? That is why we are fighting for attritions. My friend here spoke about nurse-patient ratios. Why do we have to fight if it is a reality? That should be the norm. You're safe if you have nurses. Why should you fight? That's basic, like food. Food for thought. Second, do we have really linked skill to career pathway? We speak and speak and speak. Lots of transformational conferences and workshops have happened. Have we brought it to reality? Have we linked monetary benefits to skill? Have we linked monetary benefits to the short courses that nurses do? Is skill really recognized? We recognize theory, but do we recognize skill? Think. We are still in the honeymoon phase, my friends. It's an illusion. I love you, you love me, I love my job, I love Joy ma'am, I love Clara ma'am, I love so-and-so. And then when the honeymoon phase subsides, you know, it hits you hard, then comes power struggle. Ma'am, you didn't tell me it was so hard in this ICU. Why is the doctor shouting at me? Oh yes, Joy, wake up. I can't be there every time with you. Learn to speak up for yourself. Oh wow, yes I will. Stability phase, where has it gone? If we are stable, none of us sitting here should talk of attrition as a problem. We should all be stable. Is there attrition in your own family? Is the husband leaving you, or is the child leaving you? Or are you leaving the house? Different Aadhaar cards, different PAN cards. I don't like this husband, so I'm going to sleep somewhere else. Where is the stability, my friends? We're still in the honeymoon phase and illusioning about it. Where is the commitment? Where is the deep attachment phase? We've got a long way to go. But yes, we've started. I'm happy about it. Broader leadership representations. How secure are we with job securities today? Have we learnt the ethos? All my friends here, why do we have just 10% of male nurses in this crowd? Why are we not uplifting male nurses to leadership positions? Why are we not educating them with financial roles? Are you insecure of your seat? Are you scared you will lose your seat to some male nurse? No, you won't. Give them a chance. They will guide you, lead you, protect you, and take care of you. Position, most of us, or more people who are sitting here, you must have got it by virtue of vacancy, not by virtue of an interview. Because there was a vacancy, I got promoted as a charge nurse. I'm sure many of you will be there. And your nursing heads would have pampered you, given you a coffee, given you a biryani, and told, you become charge nurse, da. It's okay, da. You're just 3 years, but I'll promote you, da. I'll speak for you, da. Total illusion, my friends. That nursing head gives you the charge nurse position and she's out of the hospital. And then there comes somebody who's 7 years old and she's like, oh, you charge nurse? I learned from you? No, 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 no. This is the actual illusion. Insecurities do not allow us to grow. The ratios are very, very, very skewed. We talk of patients who pay for nurses during their admissions in the hospital, don't they? They pay something as a nurse's charge. Even if you calculate one nurse, Joy, taking care of 5 patients and each patient paying me 3,000 per day, Joy is earning 15,000 per day. Okay? Joy is an ex-nurse. Have you ever calculated this? Is this the salary our girls are getting or girls or boys are getting? Think. Do all the overtimes get paid? It's an illusion. We'll try. We'll talk. You don't know how much I'm fighting. But the management is not allowing. Oh, why should we fight about this? This is basic. We are in an illusional phase. Top of licensing programs. Why are nurses asked to do non-nursing tasks and not paid for the non-nursing task? If I am allowed to intubate and if I can do a C line or a D line, am I getting paid? I am being glorified, but I'm not taking money. And our poor girls and boys, they think so big of themselves, they're so happy in their head because we've taught them to be so empathetic that they don't realize this is charity. But actually speaking, there's somebody else signing on your billing cards and taking the money that belongs to you. And this, my friends, is an illusionary phase. Everybody in my hospital can tell, ma'am, shortage of manpower. The phlebotomy guy tells me last week, ma'am, my phlebotomist has gone on a maternity leave, so the night samples, please tell your nurse to take. Hey, what did you study, I asked. 4 years DMLT, MLT course, lab technician course. Why should I do phlebotomy? I have learned phlebotomy, I have learned discharge, I have learned billing, I have learned insurance, I have learned everything a hospital needs to know. And that is not a nurse. That's time up. That's reality.
Joy to the world, huh?
A green card to USA, but definitely a green card to heaven, a business class ticket to heaven. So I'm very contented. I'm very, very much, if I trace my Maslow's of hierarchy, I am contented. Now let me ask you this question, because here we are talking about real-time data. Let me get the real-time data in front of you. How many of you were deputed for this conference? Can we have a hand raiser? How many of you were deputed for the conference? A big hand raiser. We've had a nice lunch. Okay, a few. Okay, but despite of the few, all of you came here for attending the conference. Why? Because you wanted to get empowered. And why you wanted to get empowered? Because you wanted to give the best care to your patients. That is the reason you came here. Second data. This conference is ANE. That means the only conference among the few. The nurses have organized this conference. The nurses have sponsored so many of the speakers and given the platform to get yourself empowered. Second data. Third data is on the stage, my dear friend. We have Madam Dr. Srilekha Rajesh, who is the Dean of MUHS, and a separate position she is able to, get in nursing faculty. And fourth data, we have Archana Bide ma'am sitting right in front of us, representing Maharashtra Nursing Council head. So we have data, we are supported. Every time, my dear friend, if we measure the support in salary, if we measure the support, and we, the problem with with all of you and my dear ma'am who just came before me is there is a misconception between illusion versus expectation. And we are women, we have a lot of expectation. Number one, expectations from our spouse. A ticket to Europe or, everywhere, from the mother-in-law, from the children, from everyone. Why do we need expectations? You are nurses, you are amazing, you are unstoppable. And you are someone said, you are the heart, you are the spine. Someone said, you are the central nervous system. I add on, you are the SA node, you are the pacemaker. That means you are at the entire body system. Why do you need support from someone else? You need to empower yourself so that you can, transform and be capable from bench to bedside. Today, I'm going to give a perspective towards the academic side. There is a nation wants to know question. These nurses, are they really taught? These Generation Z, are they engaged? Let me take you to a journey of a nursing student. With the revised BSc nursing curriculum, there is a shift in the nursing education. There is a shift towards competency-based education. The teacher is no more a sage on a stage or a guru under the tree, but she is a guide by the side. She is a facilitator. And what does she facilitate? She facilitates in transforming the fear of a young nursing grad and gives her the clear direction what she is going to be. And the very fact the student nurse is sitting on the stage, that itself shows that we are trying to acknowledge the young talent. The second, if you look in the morning session, couple of talk, the nation wants to know. Most of us tell that nurses are not professionals. We have, the system has been taken care. We have added professional values and ethics into the system. But my dear friends, professional, if I want to be a professional, it is intrinsic. It is about how I present myself. Respect cannot be demanded, it can be commanded. And how it can be commanded? When you balance your IQ with your EQ, with your SQ, and you are able to give the best possible care. With the revised curriculum in place, we have taken care of the 4 essential C's: communication, clinical judgment, critical thinking, and the very, very important is collaboration. Because collaboration is multiplication. Every time you cannot have someone and tell you, wow, you're doing an amazing job. Nursing is a selfless profession. It's a noble profession. Come on. I am dedicated to take care of my patients. Yes, I need opportunities, but opportunities cannot be, you cannot wait for opportunities. You have to see the opportunities through the invisible eye. Third, very, very important, with the advent of intensive practicum, the student nurse who goes into the semester 8 is empowered and accountable for the patient. She chases her own competency, and with the advent of other faculty development program and simulation-based training program, which is real boon to the nursing profession, I'm sure it will take care of the nursing fear. At the same time, the session of simulation-based debriefing. How many of you are ready to take feedback? We talk about appreciation, but how many of you are ready to take feedback from your peers? How many of us are ready, and how many of us really think through feedback and a constructive feedback, a sandwich method of feedback where you very nicely determine or identify the points of improvement, at the same time you pat on a back, and that's happening. That's happening. The very fact that all of us are sitting, even if it's past 4, we are sitting in this auditorium, that means we are ready to learn and we are supported by our friends. I conclude by saying that, let us be the change we wish to see in the world. Do not wait for somebody. And I really remember of the recent song, I'm sure you have heard what Shakira said, and the song that's going on for the World Cup FIFA, Die Die, Echo, Dale, Alice, let's go, which means come on, let's go, keep moving, keep marching, don't wait for somebody. No one is going to take your hand and say, come on, I'm going to take you. You join the battle through your actions, through your behavior, through your ideas, through your clinical judgment. I just want to narrate a case. I still remember I just started working in the intensive care unit. It was the 6th month of the year, and one of my patients was thrombolized. It was a case of anterior wall MI, and the new drug had come in the market, Alexim. The patient was thrombolized. And after thrombolized, I suddenly, when I asked the patient to, I was just interacting, I identified that there was a slurred speech. I immediately notified it to my in-charge, and my in-charge stood by me and she told me that, Pooja, let us inform the cardiologist. The moment we informed, a CT scan was done, there was a small thrombus in the middle cerebral artery, and the patient was rethrombosed. So what did I still feel empowered when I was working, I think it's been 15 years of teaching. I'm talking about 2010. I never felt that I need someone to support me. I took the battle. I'm sure all of you must be doing it. With that, I conclude. Thank you so much.
So Pooja comes out of fighting for the 4. I think some good sucker punches are coming. It looks like most management guys are going to hell, because only the nurses are allowed into heaven. Even your doctors were not sure yet, but I think that was a pretty passionate and even a personal attack. The fact that you're on the stage, wow. I think this is going to be a tough act to follow. So Srilaka, please.
Good evening, all. Today, I stand against the motion and strongly support the view that the nurses are celebrated in word, but support in practice is still more illusion than reality. As an academician, I would like to look at the topic from the ground reality of nursing education, clinical training, and professional practice. Nurses are often called as angels in white, frontline warriors, and the backbone of healthcare. These are words that sound respectful, but the real respect is not measured by speeches, flowers, certificates, and social media posts. Real respect is measured by how we educate, train, protect, pay, support, and empower nurses in everyday's practice. When we look at the ground reality, there is still serious gap between what is said, what actually done. My friend already spoke about, there is so many legends are sitting in front of us, including me. I became a first dean of nursing faculty in Maharashtra University after 20 years. Even I stood for 4 elections. I also thought the same illusion. I could do best in my profession. But once I entered in the reality of the universities, one of the state university, more than 250 colleges when I entered in 2024. But later, I realized this is not a reality. It is a real illusion what I could see in the university. I have, of course, I could implement the curriculum. I could do what best in my life. But the illusions are more than the reality. Because the thing is that I have many of us are sitting here, a lot of administrators, vice presidents, and CEOs in nursing. But how much of pressure you are getting, we all know. And a lot of political pressure, even Bide madam is sitting as a registrar. So how much of pressure, we can't even sleep. And since 2 years, how much of pressure we are working in the sector. It is a really illusions. Because the political influence and lot of ordinance, everything we have to fight each and every day. On the same time, my own colleagues, the principals, there's so much of explanation I have to give. Every day they will call me. What is this? What you have done for the profession? This is the illusion. So same way, the curriculum, my friend already spoke about competency-based curriculum. I do agree. 2021, the Gazette Indian Nursing Council is passed. It's a competency-based curriculum that is OSCE and simulation. But how many colleges are having institutions? See, if you look at the colleges, in all over India, approximately 8,000 to 900 colleges are available. And in that, 3,500 to 4,000 nursing colleges are providing the BSc nursing courses. But how many, so many CNOs are sitting here. Do you agree this? Once the students is passed out, how much struggle you have to do every day when they entered into the profession? You have to start from this scratch. Why we? Because my friend has already told it's competency-based curriculum. They are learning simulation. They are learning everything greenery. But then why you have to make so many education? In each hospital has got more than 10 educators. Why the nursing education department is too many numbers? Earlier I remember in 15 years back, I work in one of the top hospital in Maharashtra, that we had only 1 or 2 nurse educator. Now you wanted to show so many educators in one nursing education department in the hospital. More than 10 educators are there. Why? Because the nursing education it's not a reality like what my friend spoke. Because there is no simulation lab. There is no, every week, every day I will be getting a letter from the university. All over Maharashtra, we have got 350 nursing colleges, even Indian Nursing Council. We have to, even you must be heard about Madhya Pradesh educational institution scam. CBI has entered. More than 50% out of 300, more than 50% colleges are closed down. Why this is? We are talking about, yes, I do agree. The nursing, when I entered, I never regretted. But we are in a safer zone. But the dark era is the nursing is, and education side is very bad. Because that's why, at the same time, even Indian Nursing Council, you can Google it and see. The website is given, 1,100 nursing colleges affiliations are withdrawn. Why? Because there is no quality is present. This is the education system in India. Even the same time, then I wanted to tell the rapid increase in the colleges. Nursing practice-based professionals, the students are often only present in words without meaningful hands-on experience are not there for them. We expect the competent graduates. In all of the CNOs, we expect the competent graduates will be entering in the clinicals. But we do not always give them enough real clinical exposure, that the gap between words and in the words and practice. You know that how many CNOs are allowing the students to independently work in the clinicals? Very hardly few, because you cannot give independently students to prepare the students in the student period, because you are answerable for patients. You are answerable for patient safety. The same time, students and parents pay high amount of fees, but what outcome they are getting? Now India, if you see, the qualified faculties are very less. Lot of distance education. As per Indian Nursing Council, there is no only IGNU program is the distance education is accepted. But you see in all over India, most of all the nurses who is sitting here, we agree. How many of them are doing post-graduation? They are all doing for the post-graduation in a distance education. It is not accepted by Indian Nursing Council. This is the illusion era, the nursing education and the practice. Of course, nursing education is not reality. The nurses who comes to the hospital, they cannot do the justice to the profession. Then in same time, the nurses carry responsibility within 24/7. But they monitor the vital signs, deterioration of patients, and the medications, administer medication, prevent infections. But the policies and staffing, the patient care, infection control, quality, finance, administration are often made without proper nursing representation. Responsibility without authority is not empowerment, empowerment is only a burden. The migration of nurses, why Indian nurses has to go abroad? They don't want to leave their family and go. Why they are going? Because they are not getting a proper recognition in their own country. They have to choose for the better payment, better recognition. We are going. Last week we got in the university, Sunday I got a call from the university emergency meeting. And the Indian government is having MOU with Israel. Israel want the nurses, caregivers, that we are called as caregivers as per the government. So they want caregivers, the JD. And so even I encourage my students and principals, you please allow them to apply. So many students, my alumni and so many students are called me, ma'am, I wanted to go abroad. The later I saw the JD, I could see it is very, very pathetic stage of nursing. What they asked the JD, the nurse has to nurse, the 3 years bond, the MOU has to be taken. And the JD is, they have to take care of the patient care, everything, the caregiver, old age, population or anyone. They have to go to the shop to buy groceries. That is a JD that the Indian government is passed to all over India. The colleges, they want 3,500 nurses in June itself. So, but the JD is written, they want the caretakers has to take over. They have to do mopping and cleaning the house. They have to do cooking for the patient. And they have to do, even they have to go to the shops to buy groceries. This is a JD for caretaker. And still, I can't even tell my students, yeah, you can migrate. Why this is happening? Why the students are coming up? The nurses who is sitting behind, they can agree. They are struggling to go abroad. Why? There is no quality here. There is no, everything is illusion. This is a thing. Yes, nursing has progressed. Curricula has changed. And the technology has advanced. Higher education opportunities are increased. But the ground reality still shows wide gap between policy and practice. Before calling nurses the backbone of healthcare, I just tell you, the system must first strengthen the backbone. When you are standing, you need the spine has to be straight. Then only you can. So we are called as nurse backbone. We have to see. I would like to ask, how many of you encourage your own children to become nurse? How many of you? Why? It is the answer is silence. Then we must ask ourselves why. Because we all know the ground reality. Am I right? The same way, nurses do not need any applause. Do you want any applause? No. The slogans, flowers, and the emotional speeches that we are seen into May 12th. Last month was the International Nurses Day. We were celebrating in the social media. Are you need that? No. The nurses they need to be support, safe learning environment, fair salary, professional dignity, decision-making power, and respect as skilled profession. Am I right? I think all of you will agree. We want only this. We don't want any flowers. We don't want any gift from anybody. What is we deserve, we need to get it. And then they do not need a sympathy. Are you need any sympathy? No. We need a strength. And they do not need slogans. They need support. And they do not need the called as angels. They need to be respected, empowered, and trusted as professional. Thank you, Jai Hind. Thank you so much.
Sounds that was heartfelt, but we'll ask the kids whether it was really illusion. Right? First we'll come here, but before that I think round 2. What do you think? Round 2, I think 4 shaved it. Little bit. Huh? Come on, that was also heartfelt. And a good personal attack. Come on, give credit where it's due. I think now we have to hear from the next generation, because at the end of the day, it's measured by the outcome. We always say parents are only known for their quality by the kids they grow. Right? So, the hard work of whether it's Tangam, Clara, and many of the other leaders is only measured by the next generation. So I think we'll start off with Elaine for the 4. I think we have a little bit of time, so I think go for it, but perhaps in 5 minutes. Let's hear it.
So, I was hearing the points spoken by the opposite team where they supported the nurses are celebrated in words but not supported in the action. But today, sitting here as a student nurse, I respectfully say that this is not entirely true anymore, because I'm not standing here because of some certain words and so on. It is because of a real support, a practical support, and a transformational support. And I am a living proof that when institutions invest in nursing students, recognition turns into reality. My name is Helene Augustine, a young student, a third-year student from Yashoda College of Nursing, Gaudavalli. And about the clinical experiences that ma'am has said, ma'am, I would like to tell one experience. Recently, I was posted in an ICU ward, and an entire ward was given to me to take care of, with 24 patients, neonatal patients, preterm patients. Suddenly there was a code blue. I announced it first. Even though I didn't load any medications, no, I didn't do it because I was scared that I would hurt the patient. Even though I didn't take the ambu bag, I didn't do it. But I did announce the code blue. First, I was the one who went to the doctor, said, the patient's SpO2 is below 20, sir. You need to do CPR immediately. Yes, I was the one. I am a student, a third-year student. What do I know? I do know because of the stimulation labs. Currently in this INC syllabus, we are asked to do simulation in front of the teachers. We are made. The recent nurses may tear a paper like this, but we practically work very clearly that how it should be, one sterile field should be set up. We know it really well because we are practiced in the simulation labs. We are practiced in the FON labs. We are practiced in the medical surgical labs. Yes, we are doing it. And why did I choose this profession? Is it because of some salary? No. I wanted to become a doctor. Seriously speaking, I wanted to become a doctor, but I didn't pass in the NEET exams. I got very least marks. My mother is a nurse. She said, try nursing for once. I tried it. In the first year, I was like, why the hell did I choose this profession? In the second year, when I was told to take care of a patient, I was really scared. What should I do? Check the temperature? What if I tell the wrong? What if I check the armpit temperature and do not add the +1 mark? I was really scared. What if my BP readings was wrong? I have done the mistake. I have checked the hypertension patient's BP and I told that it is 120/80. Yes, I have done that mistake. But when I was asked to check once again, when I was asked to learn again, I checked it, I told the correct readings. I have done mistakes, but if I'm doing it correctly in the third year right now, that is because I have practiced in my clinical settings. That is the preceptorship programs that has been taken care of. The novice programs that was started by the INC. These are the reasons why I'm standing this confidently and speaking that in clinical practice, yes, we are nurses. And a patient always says, student nurses are the best. Do you know why? Maybe nurses won't listen. But we, the student nurses, are the first ones who run to the patient when a calling bell rings. The nurses says, there are so many patients to take care of, I cannot handle it. But when I said that, NICU, I took care of 24 patients, not just 2 patients. Yes, I am given the practice. And about the workshops into reality, ma'am, we are given workshops. CPR, our director has made us to do 1,000 times that we are fed up of the CPR. That much fed up we are. But again that NICU example only I will tell. When I had to say I have to announce code blue, that CPR experience was the one, that CPR simulation was the one that made me to announce a code blue. I wouldn't have done that if I didn't get that clinical practice or that practice that was made to do by the director. And about the job occupancies, we chose this profession. Which nurse, after finishing the 4th year, will sit simply in the houses? Which nurse is doing that? None of them. Everyone. Either they are entering into the teaching field or they are entering into the clinical field. Or like me, I aspire for becoming an hospital administration. Yes, I am also trying. So there also I would go against Joy ma'am. And if you are worried about money, then why did I take this profession? No, I wouldn't have taken. I have seen the nurses run. I have taken that opportunity. Yes, that's why. In my conclusion, I would like to say that both illusion and reality is supported. Completely, it is not turned into reality. And completely, it is not turned into illusion. We are in the middle. And we, the Gen Zs, will prove that, yes, nurses can be appreciated in reality and both in illusion. So in reality and also in a clinical field, not only on Nurses Day, but also every day. Thank you.
Very heartfelt. I like this, Elaine. Nice punches here. Now for the last one, and we're a bit tight on time, but guys, this is the last session, so be calm, because we have a little bit of a poll to spice it up. We're going to ask some of you leaders at the end who you believe.
Good afternoon, good evening, respected chief guests, honorable judges and delegates and teachers and students, everyone present over here. Thank you for giving me this opportunity at the ANEICON at the state level to participate as a student. A special thank to my institution, Sir HN Hospital, Research Center, College of Nursing, and very thanks to my principal ma'am, Miss Elizabeth Rodriguez, for believing me and supporting me throughout this competition. I think my friend still is in the illusion period because our parents has paid a lot of money and spending throughout the course period. Some institutions take money 4.5 lakhs, 6 lakhs, but when it comes into the reality, it hits different because lots of burden to the parents. When I entered as a nursing student in the first year, I had certain thoughts about my profession. But the reality was different. As I seeing my senior nurses are working in the different shifts like morning, evening and night shift. Especially during the night shift, nurses are not getting a proper resting period. Do you believe in me? A small break during the night can reduce the medication errors in the hospital setting area, as nurses are accountable for the patient care and duty. Naps during the night shift helps the nurses to maintain the patient's safety and helps the staff well-being. This was supported by the Dr. Nancy Regren, a European Society anesthesiologist, and she is also an intensive care unit. As she said, a short 20-minute nap during the critical hours between 2 a.m. to 6 a.m. helps the staff to overcome and drowsiness, and she can stay alert in carrying the patient care. Nurses are called angel, as I would like to quote, nurses are called angel because they serve the people through their helping hand. The care provided by the nurses to the patient is often not acknowledged by lots of people, and most of the acknowledgement goes to the doctor. Even a small appreciation can make the nurses feel happy and motivated in overall career growth and development. As I'm seeing my senior nurses are working 24 hours into 7 in the hospital setting. They are continuously caring for the patient life. Nurses are not getting enough leaves, holidays or any other occasion. Nurses are observing that they work extra duty hours after completion of 12-hour duties and still waiting for handover of 2 hours duty, which is not considered enough the work, the pay as they work they do. As I choose nursing as a profession, I thought nurses would get easily a job. They are continuously caring for the patient life. While as compared to other degrees like engineering, etc. But what I thought was exactly opposite to the real world. After entering the hospital as a nursing student, I saw the senior nurses are not paid enough compared to how much the work they do. The trainee nurses only get an annual package of 3 lakhs per annum or less than 3 lakhs. When I see my senior nurses are doing MBA and other courses degree diverted from the nursing profession. So as a student, I am confused about whether to continue as a nursing profession as my career. As I am observing my senior staff nurses at the age of 25 wearing stockings and coming to the duty as they are standing for a long hour, 12-hour duty for caring for the patient life as well as a caregiver, she has been recognized. I observe many nurses are getting vascular disease and musculoskeletal disorders like deep vein thrombosis, arthritis, lower back joint pain, as well as she gets gout in legs also. Nurses, do we, as I'm going to ask a small question, do nurses require really a chair to sit and complete their work? Say yes. So nurses also get a chair to sit for the documentation to complete their work on time, as these things are really needed in our profession, and these things are need to be seen by the administration department of the hospital setting area. As I'm concerned about the patient care and accountable work, but our administration should also took upon proper support should be provided to the nurses. Nurses are too busy because of the heavy workload and packed schedule duties. They often forget to have their food, not to get enough time to drink water in between also. As she forget herself in taking care of her patient's life, and she gets dehydration, fatigue, drowsiness, bloating, gastritis and other health disease condition as she continue care for patient, but she forget to care for herself. Yes, right or wrong? As a student, when I'm going to different hospital for the clinical practice, I observe there is a specific room for the doctor, but none for us. As people say, doctors and nurses are the core building for the patient care and the treatment. But why the discrimination is only for the nurses who serve the people through their helping hands? I overheard by many administration and the senior staff nurses that they call nurses are the heart and the spine of the hospital. We are aware these two are the important organ, but still we cannot sit, and there is no any specific rooms also. I am a nursing student from the first semester system batch. During the entire course, I faced a lot of problem in completing my assignment, that is evaluatory and non-evaluatory assignments. Due to lack of hour, I never get enough time to complete my assignments on time, study hour or any play hour due to packed schedule system, because INCI introduced a new system of curriculum. That included only the lecture hour and clinical hour we usually get. My concern is about including academic and other curriculum activities help the system to stay healthy and helps in overall growth and development. I would like to give a small quote by saying, doctors may be mapping out the war, games, but it is the nurses who make the conflict bearable. Nurses are the healthcare heroes who never seem to receive an appreciation they deserve. Thank you. We see you. We appreciate you. Thank you so much.
Right? Good. Now we're going to get some audience participation. We're going to see if the audience is sold. So first I'm going to pass it to Marina from Thane.
Good evening all. I am a GNM student. I had done my nursing from Sion Hospital. And from Sion Hospital to join a corporate hospital, it was a terrifying and a fearful journey where you see an environment full of protocols in corporate hospitals, and then you have come from an environment where you don't have a gauze piece to do a dressing and you struggle running from one ward to another. So now when I went to joined as a staff nurse in a corporate hospital, something which I learned and I understood was that I needed a lot of hand-holding. I think I was really fortunate enough to get people around me as managers, as deputy director nursing, and my director of nursing, Valsa Thomas ma'am, I'll never forget her. They were the one, even in spite of me being a junior nurse, I also did an error. I also was being told that yes, you need to correct yourself, but also given an opportunity to grow. Within a span of, I think, 2 years, it is always, also I would appreciate that the background where I came from, Sion Hospital, my teachers, my tutors, Meena Patole ma'am, Swapna Joshi ma'am, they grid into me hard work, dedication, sincerity. And being from a background of a Catholic family, always that fear of God adds to it. So it all added to my journey throughout my nursing. And I became a nursing supervisor within a span of 2 years. After that, it is all because of the support that you get from the management, the training that you get. And after being a nursing supervisor, suddenly I get a role to go in a hospital setup, which is a 25-bedded hospital. And it was being taken care of by a senior nurse who is sitting here right now, Joby sister. Luckily, I met her today. And she happened to go for a maternity leave, and 3 months I happened to be in Thana Hiranandani taking care of 25-bedded hospitals. There again, I had Sally ma'am, Valsa ma'am who supported me. I come from there, and it happened that the nurse manager of the emergency department got a job at Saudi. And here came an opportunity for me, a staff who had an experience as a nursing staff in the ward, then as a nursing supervisor, coming and standing as a nurse manager of an emergency department. Quite fearful, but again there was a twist. Luckily, I happened to attend a BLS and ACLS training, and I happened to get more than 90%. So the doctor there was there, Dr. Amol Pradhan, who told me you can be an instructor. Since 2011, I am an instructor for ACLS and BLS for AHA. And I have been training doctors, nurses, going for taking examination for doctors and nurses. So at present, I work with Jupiter Hospital, Thane. I was a nurse manager in the emergency there. And then recently, 1.5 years back, promoted as a critical care nurse coordinator. So there again in Thane, I had the hands of my Shine ma'am, the Juliet ma'am, all the senior authorities, Pratibha sister who is sitting here, Susan sister. So all these people were there who have supported us and helped us to grow. It all depends our intention to learn, to grow, and also the support system which will always help us to come up. So I think I should be for it.
I think that was a pretty strong thing for four. But let's hear a counter view. Sonia, it's yours from Medanta.
Hello. Good evening to all. By hearing her, actually I was thinking where to start and where to end. It's like you were very lucky to get that opportunity, sister. I'll say that within a short period of time, you have gone into that level and you are very lucky. So I am actually presenting Bihar today because I'm working in Bihar. I'm working in Medanta Hospital in Bihar. So the nurses, the kind of nurses which I get there, because you all know the Bihar education system, how it is. So there are other places like maybe in the southern area or northeast area, in Delhi area, and other areas you will get the nurses which has a very, I can say at least 80 to 70% of knowledge level. So to get that nurses in that Bihar side to the level of the reality shows. Actually, when Josephine ma'am started speaking, I was in the mode of reality. I was thinking, I think we have started changing, and we actually changing. But when Joy started, every point what Joy said actually has hit me like a hard stroke. Actually saying, I was thinking, how can she say my day? Because my day started like that and my days end like that. So all the points which is coming from the boardrooms to the doctors and everything is actually on the same way. So that's why I will say it is actually I think we started changing, but we still not in a reality. We are in illusion. There are long way to go, and especially the areas which is 3 tiers hospital, Bimaru states, we say it like, so that areas we have to change. So it's not that we are in reality, we are in illusion still. That's my strong point. And there are some lucky ones, I can say all of you are sitting here are lucky ones because you are reached here. We reached here, how I reached here yesterday, I know. So what all the opportunities, what all things we are getting, what all things we are not getting, we all know. So we are all lucky, but there are lack of people, those who are not lucky. So we are not in reality, we are still in illusion.
Strong words against. I think you got some good supporters here. I think now we'll hear the senior most leaders. Let's hear another one for. I hear Clara is slightly for. That is the emoji I see.
Thanks, Sam. It's very interesting. I must really thank the organizers because it's so fascinating to see the youngsters coming forward and speaking. I think couple of such sessions every day, India will wake up. And I'm sure this is a great sign for us. In 2009, when I shifted from academia, from the deanship, to take up a CNO position in a hospital, you will not believe what Joy said, everything I had been also undergoing. I used to cry in the bathroom because I fight in the bedroom for my nurses. But then I would say that there is a transition happening. We are transforming illusion to reality. And I am the witness past 15 years, and I would say that the direct reporting to CEO, not to medical head. Always nurses are in the senior leadership list. The CNOs have the position, the decision to make, the critical decision, involvement in committees, all that were possible, and I did enjoy. But again, 20-80 combination always, 20%, 80%. Rural is 80%, and the urban is 20% in India population. Hospitals, same way. And in nursing also, 80-20. Now probably we have moved to closer to 50-50 or 60 reality and 40 illusion. I think each of our leaders think of transforming illusion to reality. Next conference, we would have a more of positivity talking about, and that's why I'm standing here. And I feel we are strong. We can make it. Only thing, like, we need lot of hand holding of nurses to pat them back, and all that we need to do is we have to reduce hierarchy, we have to reduce bureaucracy, we should feel equals with our colleagues. That is very important. Whether the director of nursing or whether you're a CNO, you are equals with the nurses at the bedside. And as Joy rightly said, from boardroom, we have to walk into the bedside. Even if a chairman calls, a CEO calls, if you are with a nurse or a patient, you cannot attend to CEO or a chairman. First attention should be to our nurse or to our patients. If we follow this, I have followed it, that's why I'm standing before you. If we follow this, I am sure, we will transform into 80 this side and 20 that side. This is what is my conclusion. Thank you.
Good words, Clara. I am not fully sold. You've got Shija here who has a slight opposition, so I'm going to pass it to her. And I think, please stand up. She's from Mumbai, so our hometown. From Tamil Nadu back to Mumbai.
Thank you, and Dr. Mehta is really creating, it's... Okay.
Spice.
Thank you.
So he's really creating, it's not a debate, he's really creating the, divide and rule policy, I suppose. And as Jyoti ma'am has said that what was her experience, in my nursing journey, I was into the nursing education for some time, and with great pride, I entered the nursing services, and I was like, I have dealt with the budding nurses. I have sown the right seeds, and now I know what education and how much struggle we are taking to bring up a nurse who will be ready to face a patient in the healthcare system, and also whatever other things come across. So very proudly I entered the nursing service, and it was a reality shock for me. Right from the recruitment side, I can say.
Sure. Thank you. Don't come to me.
First I had, I had a big line of questions where I thought, yes, my nurse is ready over here. And that was a big illusion for me, that she's ready to take care of the patients when she couldn't even answer her basics. And I was like, how would I entrust my patient to this nurse? Yes, she needed hands. Everybody uses this word very proudly, hand-holding. So hand-holding, for how many hours will I stand behind this nurse? And how will I ensure that my patient will be, she won't be causing any harm to my patient. So that became a nightmare. So from that onwards, then addressing from bedside to boardroom, yes, it's an everyday struggle to convince the management, yeah, we need to empower nurses. But again, the illusion was, yes, will my nurse take it ahead? So I support illusion.
So I'll take a last pit stop, right? We have one more voice there, and then we have the balance voice. Sorry, ma'am, we're on time shortage. How many still think it's action? I have one voice. Doesn't sound like a very strong voice. Illusion. Momi, up to you from Assam, and then we're coming back. Less than a minute, please.
Thank you, sir. Thank you so much. And sir, let me be in the illusion, sir. Sir, let me be in the illusion that you will come to me after 5 minutes.
Nah, 1 minute. I'm coming there only.
First of all, I love you, Joy. And that's a reality. And not an illusion, please. I'm dedicated to my patients. As members from for the motion has said that she is dedicated to the patients. Yes, I am indeed too. But at the cost of my everything, my dear, everything. My time, my voice, my right to have the right remuneration. At times, not even given recognition when in media a major surgery is highlighted with the doctors in the limelight and the people who were behind the scenes putting everything in place, starting from sterilizations, are nowhere to be seen or mentioned. I'm really sorry to say that. As for expectations, as of course, we all have joined nursing or any other profession for that matter for a job. I wonder if there is anybody in the reality who will work honorary after completing the so-called a very noble service. But yes, I'm really impressed. I'm really impressed to find a new generation who said that she joined nursing not for salary. I'm really impressed. God bless you, my child. I also wonder how many administrative or leadership positions are created in each state to accommodate deserving candidates in the government sector. I really wonder. I am into government sector, and for that I know it better. We have to join the war, as our learned members for the motion has said that we have to join the war. So finally, it is accepted by the learned members that we need to fight, as we are still fighting since time immemorial to break the illusion, to make it a reality. Let me pray it happen within my lifetime, as I'm 55 now, with only 3 more years to go to call my professional life off. So my sincere prayers to make this illusion to come into reality. Amen from my side. And I must put one more point here, that there was a point regarding deputation.
I'm the nursing superintendent of my medical college, which is Assam Medical College Hospital, Dibrugarh, which is a pioneer institute. It was established in 1947. And I'm also the principal school of nursing, AMCS Dibrugarh. I'm really sorry to say, I'm really sorry to say that I was not empowered to depute even a single nurse to this conference. I'm really sorry to say this. And yes, all the power against the motion. Thank you. Thank you, sir, for the time.
Thanks, Momi.
We need to wrap up fast, otherwise we'll be hit with Mumbai's reality traffic.
But we need the last word. And we have to go back to founding president and one of my favorite people, Tangam. So few last words, ma'am.
Thank you, and how are you all? So we have a general body meeting immediately after this, so I would request all the ANI members to stay back and we need to go to the ballroom. Just a reminder, and I know it's too late. I will not say much. What I see today happening is a reality, yes or no? Yes. Was this an illusion in 2001? It was an illusion because we could not think that something like this can happen. So I told Sam that I'm not for and against because they had to speak for and against. But I'm sure if you ask them personally, they will have both sides. There are many plus points, but the reality remains we have a long way to go. It's a long road before we can say that we have arrived. And ANI is one vehicle that we have established through which you can reach there faster. But we need all of you to rise up. That is what is required. And with that request, thank you, Sam. We exceeded the time too much, but it was very engaging. Thank you very much.
Thank you, Tangam. The reason we took this, right, guys, is, you know, when we founded ANI, and I have to give hats off to the many leaders that are sitting here who sacrificed a lot. She's absolutely right. In 2000, there wasn't much. Actually, I would say in 2011, there wasn't much either, right? So the fact that we've now got some 600 to 700 people sitting in the audience that are more empowered means that we're only partway through the journey. It clearly looks like free tickets to heaven didn't make a difference. It clearly looked like that your AI defense jobs, simulation training that's come in, or even a youngster who is all excited about her career didn't make that difference. It looks like you've got the next Vijay here, except she's joy to the world. I think you should use that thing. I think the personal attack withstanding, I think you've rebutted that very well. I think your kids will be proud. And I think well done, guys. And thanks to the audience. Look, guys, this is not going to be easy. I think my only suggestion is get more seats at the top of the table. When there is no choice but to listen to you, there will not be a discussion about deputization, budgets, manpower. There will not be discussions whether the nurse is important because you're fundamental. So I think with that, thanks a lot to ANI. I am pleased beyond my wildest dreams of what ANI has achieved. So Tangam, on record, outstanding with you and the team, and of course carried on by our rock stars of today, but I think the many hard shoulders of times yesterday. So well done, guys. And back to you, and I apologize. I will take all responsibility for the delay. My fault. Thank you.
Thank you, sir. That was fiery. So we have around 400 people currently. I want each one of you to put your hands together for a thunderous applause for all of them over here, especially for Elaine and Suveta. You guys were fabulous. You will go a long way. Looking forward to you entering the ring in the future.
Thank you, Dr. Samir Mehta, sir, and all our debaters for a truly insightful and engaging debate. May I now request all of you to kindly proceed to the designated photo corner for a group photo.
All the ANI members kindly wait back for the annual general body meeting at the ballroom immediately. Thank you.